So individuals with severe mental illness use tobacco and suffer from tobacco-related diseases and conditions at a much higher rate than the general population. So our latest New Hampshire data shows that about 18% of adults use tobacco. In our enrolled population in our Integrated Center for Health, we see about 50% and over, fluctuates from month to month, use tobacco on a daily basis. So we recognize that, in community mental health, I think sort of historically, traditionally, tobacco use is seen as sort of just a given. It's a part of our clientele, and that's something that we're really trying to shift. We know that adults with severe mental illness are dying on average 25 years earlier than the general population, and this is from preventable diseases, and tobacco is a significant catalyst for a lot of those diseases and something that we can really make an impact with. So what I would tell a colleague who says that there's nothing that they can do to get a patient to quit is, there's nothing you have done yet to influence a patient to quit. I think, as a helping professional, one of the most valuable things that we can do is hold hope when a client can't. And as long as we can keep the dialogue going and maintain a future-oriented perspective, change will happen, and it may not be when you want it to happen, and it may not be when you expect it to happen, but if you can continue to, look for that nugget of motivation and find that open window, there will be a time when that will happen. In our community mental health center, we have various roles, many of them coming from different disciplines and orientations, and we also now have the benefit of primary care. So what we see is that, depending on where the staff member is working with the client, be it in their home or the community or in an office setting, and what sort of relationship they have with that person, what their particular role or intervention is in the client's treatment, all of those things can come at the issue and find motivation from different angles. And so we find that a systems approach to working towards tobacco cessation or reduction really makes a big impact.